And there is Dr. Chokshi. Thank you so much, Commissioner, for joining us again. Today, our topic is New York City's plan for vaccination and our continual fight against the second phase of this pandemic. And those are our two topics which are intimately linked, neither of which we can ignore. We do a little bit of Spanish here, so brevemente, yo soy Mark Levin, concejal del Distrito 7, a cargo del Comité de Salud del Consejo Municipal. Ustedes saben que pueden sentirse libres de hacer sus preguntas en cualquier idioma, español o inglés. Y por si no lo saben, el comisionado habla español y él lo ha dicho públicamente, así que le comento que su esposa es dominicana. Así que ya ustedes saben, esto es multicultural. We welcome your questions in this hour, so please put them into the chat and we'll get to as many as we can. But I want to frame this conversation with the sober news. We got updates from the state just in the last hour. According to state data, over 4,000 newly identified COVID cases in the 5 boroughs in today's report. And the number of New Yorkers, our fellow New Yorkers who are hospitalized with COVID today stands at just short of 2,000. That's just in the 5 boroughs. So we are celebrating today the incredible news that vaccination has begun. And we are also still keeping a very close eye on a pandemic, which is continuing to spread in this city at an alarming rate. So we have to talk about both of those factors today. And we have with us absolutely the best person to have this conversation with. I am so grateful that the Commissioner of the Department of Health is back with us again. And I always like to say that we are lucky in New York to have the best big city health department in the world. And they have proven it in this crisis. And it means a lot that the leader of that department is with us here again. So Dr. Chokshi, thank you for joining us. And I'm going to turn it over for you if you'd like to offer us a big picture of where we are in this moment in New York City. Thank you, Commissioner.
Thank you so much for having me once again, Councilmember Levine. I really appreciate the chance to speak with you and your constituents, but I have to say particularly now because it is such an urgent time for the reasons that you have pointed out. So I'm grateful for the opportunity. I'm going to aim to keep my remarks quite brief because I know that there are a lot of questions that we want to get to, and I think that will be most helpful for everyone. But let me start with the big picture, which is, as a council member pointed out, we remain in a state of emergency when it comes to COVID-19 in New York City. Unfortunately, our cases, our hospitalizations, including severe illness, all of our numbers are becoming more worrisome rather than better. And so this is something that I continue to take very seriously and that we all have to ensure that we're being vigilant about and disciplined about. And I know how much people have already been doing that over the past few months, but we've got to hold on and actually double down because we do see a light at the end of the tunnel now. So I'm going to reiterate, our guidance that I know that you've heard from us before, but which is extraordinarily important in this moment. And the reason why is that with cases increasing, with the level of spread that we're seeing, the way to think about it is that everyone is at higher risk because there's a greater chance that you will encounter someone who may be infected with COVID-19. And remember that one of the most dangerous parts of this virus is that many people may be infected but don't show any symptoms. And so they may not be aware that they have the virus themselves. But as we look forward, and I'll talk about the vaccine in a moment, I want us to look back as well, because we can look back at what has worked for us in the past, what brought us to a point over the summer and the fall where we were really in a place where the virus was in much better control. And we now have the benefit of experience to know what those key things are. Wearing your mask, both indoors and outdoors. Staying home, particularly if you're feeling ill, but growingly, particularly if you're someone who's at risk or lives with someone at risk, to stay home if you can. Make sure that you're washing your hands frequently, make sure that you're getting tested, and doing all of these things rigorously, and also ensuring that your family members, your neighbors, your community members are doing the same thing. And finally, one more note on this, which is, I know it's the holiday season, and I know it's a difficult message to swallow, particularly given the year that we've all experienced, but it is so important not to travel and not to gather during this holiday season. I know how hard it is, and I wouldn't be giving this advice unless I thought it was absolutely necessary. But given what we're seeing in our city, it is. It will save lives if we make these small changes, these small decisions. They add up in a way that makes a big difference, again, particularly for people who are most at risk. Moving to the vaccine, just very quickly, let me just start by speaking from the heart about what I'm feeling right now, which I think many of you may be as well, which is, this is, as the mayor has said, a shot of hope for all of us. It tells us that there is something that can change this pandemic and change the trajectory of the pandemic. But even though the cavalry is coming, it's a slow and steady march. It's going to take several months for our vaccination campaign to ramp up, for us to have enough supply of the vaccine, to get it to as many New Yorkers as possible. But we started this week, and I have to just share how much my heart lifted when I was at one of our New York City hospitals yesterday and saw some of my fellow healthcare workers get the very first vaccines in the entire country. And I can't even convey, the emotions that ran so high, not just because it meant protection for people who were so deserving of it, but because it is a release in so many ways. It's a way of honoring people whom we have relied on for the last several months, people who are fathers and mothers themselves, nurses and doctors who have taken care of our mothers and fathers, when they were hospitalized, when they were feeling sick, and who have borne so much on their shoulders. And so to see them start to get, the first layer of protection with their first dose of the vaccine is something that I found so heartening and hopeful, and that is going to change what's happening with COVID-19. So very quickly, I'll run down, the vaccine updates before we turn to question and answer. First, there are two vaccines, as you may know. One is manufactured by Pfizer, the other one by Moderna. The one by Pfizer was the one that was reviewed by the federal government, the FDA and the CDC, which authorized it for use. And that's the one that has been started to be delivered across New York City. As of this moment, over 40 hospitals and over 40,000 doses are either delivered or en route to those hospitals today. We anticipate some additional hospitals and doses being delivered tomorrow, and there will be another supply starting next week as well for the Pfizer vaccine. The Moderna vaccine is the other one. It works using the same technology, which is mRNA technology. And we got a promising review from the FDA this morning indicating that it too is a safe and effective vaccine. It will go through some additional steps where people really take a fine-tooth comb to understand the science and make sure that we know all of the nuances of it before it's being authorized for use. But it looks very promising. My expectation is that the Moderna vaccine could be authorized as soon as Friday. And if that happens, we'll start getting it delivered to New York City as soon as early next week as well. Now, the final point that I want to make on vaccines is that I know everyone is interested in the prioritization because we're in this situation where supply will remain limited for several weeks. There are very tough decisions that have to be made about who is being prioritized for the vaccine. The principles for that prioritization are important to spend a moment on. It's people who are at greatest risk, like our high-risk hospital workers, and also people who are at greatest risk of having severe illness if they get the COVID-19 infection. So that's people like our nursing home residents and staff, and people who are in other long-term care facilities. So it's those people who are being immediately prioritized. There will be other healthcare personnel who will get the vaccine after that. And then we await some additional guidance from the federal and state governments to understand who will be next in the sequence. But most likely it will involve some combination of essential workers, particularly people who find it difficult to physically distance in their workplace, and then people who are at risk of severe illness, like New Yorkers who are above the age of 65, people who have underlying medical conditions like diabetes or heart disease that put them at greater risk for severe COVID-19. And as soon as we get additional clarity from the federal and the state government about that prioritization guidance, we'll be sure to communicate it to all of you as well. But the bottom line is that this phased distribution of the vaccine will take some time. We want to work through the very initial phase in the coming weeks, and then the next phases around essential workers and people who are at greater risk over the next month to 2 months. And then I think from there, we'll continue to expand the circle out until we hope to get it to everyone in the general public who wants a vaccine by the middle of 2021. Hopefully sooner if the supply picks up, but that's the best estimate that I can give you at this moment. Final point, we're working to ensure that getting the vaccine will be easy, free from barriers such as cost, particularly cost to individuals, as well as immigration status, which is very important. Immigration status will not be a barrier to getting a vaccine, and communicating that vaccines are safe, and that we have every reason to believe that the vaccines that will be authorized will be safe as well. So with that, let me wrap up by saying we have vaccines. Our job is to now turn them into vaccinations. I'm really excited about the prospect of how this is going to change life in New York City. But just because there's a light at the end of the tunnel doesn't make the tunnel any less perilous. And in fact, we have to double down right now so that we can prevent as much suffering to get to that future. Thank you again.
Thank you, Commissioner, for that excellent overview. And I think this moment really is like our generation's moon landing. I mean, the achievement of going from identifying a virus in January to having actual injections of a vaccine in 11 months, it's just astounding. It's an accomplishment for the ages, and something I think we can all be proud of. It doesn't detract from the short-term fight we had that you very powerfully discussed, but this is big in a moment of enormous hope. I think you mentioned that the two vaccines that are closest at hand from Pfizer and Moderna are based on a relatively new technology, messenger RNA, mRNA. And boy, is there a lot of misinformation seems to circulate on social media about just how mRNA works. Perhaps you could just very briefly in layman's terms explain it, and perhaps you can dispel some of the rumors online about it messing with your genetic code, which it doesn't do, supposedly injecting you with the virus, which it doesn't do. Explain to us, what exactly does mRNA do?
Great, thank you for the question. It's a really important one, and I've seen some of these rumors about it as well. So let me start with what the vaccine is not. As you pointed out, it's not a live virus. So you can't get the infection from the vaccine. That's a really important point. So let me just repeat it. You cannot get the infection from the vaccine. It's also not DNA, and it doesn't affect your DNA. So the way the technology works, the mRNA doesn't enter into the nucleus of the cell, and so it doesn't alter a person's genetic code. So to review, you can't get the infection from the vaccine because it doesn't use live virus, and it won't alter your genetic code. So to your question, how does it actually work? The way that we should think about it is really focusing on what the M stands for in mRNA. M is messenger, means it's a message. And basically that message is one that encodes a protein. It's called the spike protein of the virus. The cell takes that in, it actually develops that protein so that the body can recognize it and build immunity to that protein. And then as soon as that happens, the mRNA is released. It means it's disintegrated. So it no longer is in your body or in your cells. All that remains is the immunity that you have built up to the virus and the virus protein, so that when you do encounter the virus, your body recognizes it and can mount an immune response to it.
That is excellent and very clear. Thank you. We've had some questions, and forgive me, I don't see the name of the person, but we had some questions about reports of allergic reactions to, I guess, the Pfizer vaccine particularly, and the individual asked a question because they use an EpiPen. And how should we understand people who have allergies and what this vaccine might mean for them?
Yes, this is something that we are following very closely with respect to people who have allergies. But let me start by saying the vast majority of people who have allergies, whether it's food allergies or if you're like me, I have allergies to dust and dust mites. That is sometimes associated with asthma. Those allergies, seasonal allergies, none of those bear on whether you should or should not get the vaccine. Meaning, if you have those allergies, the vaccine will be safe and effective for you. The people who should have a conversation with their doctor about this are people who have had very severe allergies to a vaccine or to a medicine taken by injection in the past. In those cases, and it sounds like the person who carries around an EpiPen may or may not fall into this category, but if you've had a severe allergy to a vaccine or to a medicine taken by injection in the past, I do encourage you to discuss it with your doctor. In many cases, it may still be that the vaccine is safe and effective for you, but we need to have that conversation between the patient and the doctor to really know the particulars of it.
It's such an important point. You shouldn't conclude based on a news report that you're not eligible for the vaccine. If you have doubt, talk to a medical provider. Let them guide you. We don't want anyone mistakenly thinking they're not a good candidate for the vaccine when the doctor might have told them otherwise. And we do have a question sort of in this space from Laura Weiss, who says, should organ transplant recipients who are immunosuppressed get the vaccine? And if so, Pfizer or Moderna, should they get 3 shots to boost their response?
All very good questions. I'm going to start by reiterating, for specific clinical circumstances, the best thing is to speak with the doctor who knows you and your conditions best, because there are a lot of nuances here that public health guidance, is not appropriate to really, sort of navigate the particulars of an individual situation. What I will say more generally about people who may be immunosuppressed for various reasons, whether it's because they're taking a medicine that suppresses their immune system or they have a disease of the immune system, there are no contraindications to getting the vaccine simply because you are immunosuppressed, meaning the vaccine is likely to be safe and effective for you as well. But I do encourage you to have a conversation with your doctor to allay any concerns and to talk through the particulars of your situation.
Thank you. Doctor, on the prioritization question, we've had a number of people ask about prisons or jails. I think both with people who are incarcerated as well as staff. And one of the people asking the question, it's great that she's on, is a very prominent physician who you know well, Dr. Uche Blackstock. Do we know when people who are in our jail system will be eligible for the vaccine?
Thank you for the question. And I also want to thank you, Council Member, and Dr. Blackstock for writing about the important topics that you have with respect to ensuring that equity is at the center of our response, and frankly should be a part of our responsibility in terms of turning vaccines into vaccinations. I particularly appreciate how much you have spoken about the key role of trust in in making sure that that happens, and for us to acknowledge the reasons for distrust that may exist in certain communities, to sit with that, and also to think about the ways in which we should ensure that vaccination flows along the trusted relationships that already exist in our communities, whether it's community leaders, faith groups, the relationships that individual patients have with their doctors as well. But let me take the specific question that you were asking about, which is about people who are incarcerated as well as the staff in jails and prisons. So the answer to this is that we are following it closely as well, because I'm also concerned about what we have seen in jails and prisons with respect to outbreaks, around the country, frankly, because there have been too many people who have been infected with COVID-19 and suffered from severe illness in jails and prisons. And so it's something where when we talk about trying to save lives and prevent suffering, it should be, a part of our approach. My understanding, based on the conversations that have happened at the federal and the state level about this, is that people will likely be in a priority group in the first phase of vaccination. So not in this immediate part of the first phase, which is for high-risk healthcare workers and people in long-term care facilities, but subsequent to that, because of their risk living or being in what we call congregate settings, which includes jails and prisons. So we have to wait for the specific guidance, which will be coming out from a CDC advisory committee, as well as from the state. But it's an area where, as a doctor, as someone who believes in health as a human right, where we have to encourage that the vaccine gets to our fellow humans in those places as well.
Thank you, Doctor. There's another class of congregate settings, which are homeless shelters. And I understand it sounds like the protocols are still being set up, but I just want to say how important I believe it is that jails and homeless shelters be extremely high in the priority list, simply because of the danger there. And in fact, we saw a pretty frightening outbreak in a federal facility in Brooklyn in the last week or so. It's called the Metropolitan Detention Center, where I think there were 80 cases in one unit. It's just a frightening reminder that this virus spreads in congregate settings, and that includes nursing homes as well as jails and homeless shelters. So as soon as you have an update on that, please let us know. And I might ask one of our team members to drop a link to the editorial, the op-ed that Dr. Blackstock and I wrote on equity issues into the chat, so that those who want to can read it. We have many questions, Commissioner, about people who are high risk because of age or medical condition, and understanding as much as we can determine now the timing of when they would be offered the vaccine, how they'll be informed about the availability and their personal eligibility. And without giving you too much for one question, if you could talk about where vaccines will be dispensed once we're beyond this kind of narrow phase of specific workplaces.
Thank you. Let me try to lay out the big picture, and then Councilmember Levine guide me where I should get into some additional detail. So the way that we should think about how this is going to roll out is really in 3 phases. Phase 1 is when we know there's going to be limited supply of the vaccines. And in that phase, there will have to be these challenging decisions made about prioritization. So that's phase 1. Phase 2 is when supply starts to catch up to the demand for the vaccination, when we'll be able to expand out, the groups that will be eligible for vaccination. And then phase 3 is really when we have supply that is sufficient to meet the overall demand, and that's when the general public will be eligible to be vaccinated. Now, there's a lot that is unknown about exactly what the timeline will be across those 3 phases, but here's what I can give you in terms of an estimate right now. As I mentioned, I don't think we'll get to phase 3 until well into 2021, potentially the middle of 2021, with respect to having sufficient supply for everyone. I think that we will get to phase 2, where supply is catching up to demand in the spring of 2021, perhaps March and April. And until then, we'll be in phase 1, where we have to work through the prioritization groups because of that limited supply. I believe that will last through February because we'll work from where we are right now, high-risk healthcare workers, long-term care facility residents and staff, expand it to first responders who are also in roles that put them at risk for infection and illness, and then getting to essential workers, particularly those who may not be able to physically distance, and then people who are at risk either because of age or underlying illness. So that's the roadmap. I know that, for an individual who's trying to figure out where am I along that roadmap, I just want to be upfront and acknowledge that we don't have that granular detail for you at this moment, in part because there are some value trade-offs that are being thought through in terms of the federal and the state guidance. So what our commitment is to be as transparent as possible as that prioritization gets more specific and clear. There's one other thing that I'll say before turning it back to you, Council Member, which is there's also, a big question about the where. Where will I get the vaccine? So, I understand that the vaccines are being delivered to hospitals right now, but does that mean that only hospitals will be the places where vaccines are administered? And the answer is no. And the reason goes back to what we've talked about, which is trust. We want the vaccine to be administered in the places that all of you already trust, getting your routine vaccines, whether it's for your seasonal flu shot or for any other vaccine. So if you're used to getting that at your community clinic, your community health center, we want you to get it there. If you're used to getting it from a hospital, we want you to get it there. If you're used to getting it from a pharmacy, we want you to get it there. And so we're going to partner with all of those places to try to expand access as much as possible.
And family doctors as well?
Family doctors as well, exactly.
Okay. Yeah.
And all of this, will unfold in phases, but the goal is to get it to all of those access points.
Thank you. I just want to mention we've had some news in the last few minutes because of the snowstorm, which I know is all very much on our mind. The city's public COVID testing sites are going to close early tomorrow at 2 p.m. and they're going to remain closed until noon on Thursday. And if you'd like updates on this, you can call 212 COVID-19. That's the city's COVID hotline. It's very easy to remember. I guess I'll ask someone to put it into the chat, but it's so easy to remember. 212 COVID-19. Commissioner, I understand there's also a plan to set up, I think what you call pods, which are sort of like pop-up dispensing sites for vaccination in public schools, which is, look, as you mentioned, it's important that we get out of big institutions into neighborhoods to really reach people where they're at. particularly in the hard-hit communities that have disproportionately borne the brunt of this pandemic, Black and brown neighborhoods. And I do think getting out of chain pharmacies and hospitals is important. And I understand that you have some early planning on that. Could you explain to us what those sites what will be, where they'll be set up, and how you'll run them, if you know?
Thank you for that question as well. I think the most important point is one that you just mentioned, which is the goal is to have access points in places that we know have been historically underserved, and to make sure that we again rely on the trusted relationships that already exist in many of the communities that have been hardest hit by COVID-19 over the last few months. The mayor has been very explicit about his commitment to the 27 priority neighborhoods where that there is an intersection of historical disadvantage, which we should acknowledge is often due to structural racism, as well as the fact that there are institutions whom we need to partner with in those places. So you mentioned many of these already, but let me just recap. Community health centers, particularly federally qualified health centers, independent pharmacies, which people often go to, particularly in the boroughs like where I live, compared to chain pharmacies, which are more heavily represented in Manhattan and in more affluent areas. The local, 1 and 2 family doctor clinics. So partnering with all of those places is part of our of how we wish to expand access. Beyond that, and again, if we have sufficient supply of the vaccine, we are thinking about additional access points. And one potential solution for that is what you mentioned, which are pods or points of dispensing. What we and other local health departments around the country have prepared for, in terms of mass vaccination. So we have a team at the ready, particularly if it looks like access is not sufficient in particular areas, including those hardest hit neighborhoods, to rapidly stand up additional access points like that.
This is an important point. I don't think people understand that the New York City Department of Health has been preparing, drilling, planning for a mass health event for some time. Some of them could be biological attacks or other horrible circumstances, and that you've worked out a plan to very quickly deploy staff, get facilities up and running. Probably don't have time to go into the details of that, but am I right that this kind of sort of widespread vaccination or inoculation is something that you've been planning for years, correct?
That's right. In so many ways, the team here has been planning for years, and I would just add the last several months in particular, specifically for the COVID-19 vaccine. So we're going to do everything that we can to meet New Yorkers' needs. That's
great news. Many people have asked about whether there'll be some sort of personal information that they'll receive to inform them that they're eligible because of their status, either underlying condition or other factor. And I see kind of a related question that here now Susan Stein is asking is, will vaccination be done by appointment? Maybe the kind of thing you have to go to online and they sort of validate whether you're eligible because of your occupation or your health status. Do you know either about kind of the information flow or the appointment system yet?
Yeah, both good questions. Yes, I do think that there will be more individual communications that are able to go out, again, as we get further into the vaccination process. But we will, again, rely on the relationships that all of you already have, whether it's with your family doctor or with your pharmacist to help with that. Our goal and what we've been planning for is to ensure that we have the best science-based information to equip those people with, so that they in turn can answer all of your questions. And we've already started to push out a lot of that guidance. We'll be working directly, in terms of our public messaging as well, I want to just highlight, we already have a website up. It's nyc.gov/COVID vaccine. We update it regularly. There will be other resources linked to through that website. And so that's another place where you should bookmark it, and check it frequently. With respect to appointments, what I'll say briefly is that I do think that, as this becomes more broadly available, appointments will be used very frequently. And this actually connects back to what we were saying before, which is we remain in a public health emergency. We remain in a time where, unfortunately, we're seeing a surge in cases. And so even as we administer vaccine, we're going to have to make sure that we're keeping our distance, that we're masking up, that people are flowing through the places where they will access the vaccine in a safe and healthy way. And I believe that appointment scheduling will help us with that.
Yes, as Nathan Simmel points out, we don't want long lines waiting for vaccination because that obviously it's a risk for spread. We've seen that, unfortunately, at some of the urgent care centers for testing, and we want to avoid that if we can. Commissioner, not all healthcare workers work in hospitals or even formal medical settings. We have many home health aides that are just such a critical part of our health system. And frankly, they have faced real risk because they're generally caring for elderly, more vulnerable people who themselves are high risk. Are they slated to be high priority for vaccination? And how will that work?
Yes, thank you for this really important question. I want to just start with a personal note, actually. When I was at Health and Hospitals for many years, as you know, council member, one of my responsibilities was to lead our home health agency there. And as a doctor, I would accompany our visiting nurses and our other home healthcare workers out on their visits. And I saw firsthand how tough their jobs were first. And then second, how vital they were, particularly to people who may be homebound or otherwise vulnerable. And so they are not just healthcare workers, but healthcare heroes in so many ways because of that. So the short answer to the question is that yes, after high-risk hospital workers receive vaccine, it will be made available to other healthcare workers. They're prioritized in that first phase as well. And we will work with the right places where home healthcare workers can access the vaccine, whether it's community-based healthcare facilities or the organizations that employ those home healthcare workers themselves.
Might you set up pods, to use the term again, points of dispensing or distribution, I forget, but that are just for home healthcare workers, maybe in a few select neighborhoods where there's a high concentration?
That's a possibility as well. We always want to rely on the existing infrastructure where we can because of those trusted relationships
Right.
that I mentioned. If it turns out that there's not sufficient access, and no decisions have been made about this just yet, but if there is insufficient access, then yes, we can stand up dedicated points of dispensing or pods.
Right. One of our panelists asked about people who maybe are not formally healthcare workers, but have a role caring for a family member, a younger family member, caring for an older or vulnerable family member. Is there a provision for them as essentially de facto healthcare providers?
That's an important nuance, and I don't believe that they would be considered healthcare workers in the same way, with respect to how the prioritization will work. But they should be a part of the group that we think about getting vaccinated sooner than the general public, because they are working with people who are at higher risk. And I will say, for those people, for caregivers, in particular, it's very, very important for them to remain vigilant and disciplined during this time because of the spread of COVID-19.
Exactly. We've got a question from Rachel Nurse Baker about the vaccination for people who are pregnant or breastfeeding. And I know there's similar questions about vaccination for children because I guess the Pfizer and Moderna have been approved for age 16 and over. Any updates on those two important groups and whether and when they should seek vaccination?
Yes, also important questions. Let me start with the question about children. And I say this as a father who is eager for the day when my daughter can get the vaccine as well. But for the two vaccines that we believe will be coming, the Pfizer and the Moderna vaccine, neither is authorized for children under the age of 16. The Pfizer vaccine was authorized for people who are ages 16 and up. The Moderna vaccine, which is being submitted for FDA authorization, would be for ages 18 and up, if indeed it does get authorized. So we will have to wait for a future point when there's been sufficient testing, to ensure safety and efficacy in children, which I hope will be sometime in 2021, but we have to follow the science on that point. Now, with the second question on people who are pregnant or breastfeeding, the CDC did issue some clinical guidance on this just recently for the Pfizer vaccine. They said there was no contraindication to vaccination for people who are in those groups, which, let me just say that with a little bit less jargon. It means that people in those groups are permitted to be vaccinated. There is an important qualification here, though, which is that there's not the same degree of scientific evidence as there is for other people. So if you have any questions about safety and efficacy, if you're pregnant or if you're breastfeeding, again, I encourage you to have a conversation with your doctor about that so you can talk through the nuances and the risks and benefits in your particular situation.
That's extremely helpful. We have several questions about the second shot that's needed. I see one here from Susan Stein. Of course, both of the vaccines that are on the horizon here, Moderna and Pfizer, require a second shot. Could you tell us if there's any difference in the time between shots between the two vaccines and what kind of leeway is? And I presume when you go in for your first shot right there on the spot, they're going to schedule your next one, I would hope. Maybe you can tell us how that will work too.
Sure. Let me walk you through the process as we are seeing it unfold. So you go in, as we talked about. Hopefully, you have an appointment. You're scheduled for it. You go in. You maintain your distance. You keep your mask on. You get your vaccine, your first dose of the vaccine, that is, and you'll be observed for a period of about 15 to 30 minutes to make sure that you don't have any problematic reactions to the vaccine. During that time period is when we're encouraging people to schedule their follow-up appointment for the second dose of the vaccine. For the Pfizer vaccine, that will be about 3 weeks after the first dose. For the Moderna vaccine, it will be about 4 weeks after the first dose. And yes, the really important point here is that all of the scientific studies have been done with both doses. So that's how to get up to that 95% level of effectiveness that you've been reading about in the papers, is if you complete both doses in the series.
Commissioner, will people be able to choose which vaccine they want to receive?
This is a really important question, and my honest answer is I'm not sure yet. It will depend a lot on how much supply we have of the two different vaccines. It may be the case that we have more supply of one vaccine than another. There are some important differences with respect to how the vaccine can be stored, which may make a difference in terms of where it can be administered. And based on that, it may mean that only one vaccine is available to certain people. My hope is that as supply ramps up, there will be enough supply of both vaccines for people to be able to make a choice about it. But I would say, based on what we know about the vaccines right now, unless you're 16 or 17 years old, and only qualify for the Pfizer vaccine, or potentially some other specific considerations, Both of the vaccines are very safe and effective, and there are not huge differences between the two that we're seeing at this moment.
Many people have asked if I've had COVID already, do I need to get the vaccine? And even from kind of a policy perspective, if there's a shortage, do we want to have folks who've got tested positive for antibodies to get the vaccine? What's the current guidance on that?
Yes, another really important question. The big picture here is that the vaccines offer protection even if you have had COVID-19 in the past. Let me just repeat that because it's a really important bottom line. The vaccines do offer protection, and it appears that it's additional protection even if you have had COVID-19 in the past. So that's the big picture. There are some specific nuances here. Again, I feel like I've been saying that a lot because sometimes the science is a little bit complicated. But basically, here's how to break it down. First, if you're acutely ill from COVID-19, meaning you have symptoms, you were only recently diagnosed, you should wait until after you have symptoms and they've resolved, and you've finished your isolation period, before you get the vaccine. It is possible, and the CDC has stated this, it is possible that people may want to wait until 90 days after their diagnosis of COVID-19 illness to get the vaccine. And the reason for that is we know that protection against the virus is significant in that 90-day window. So the CDC has recommended that it's okay to defer the vaccine for those 90 days. And some healthcare workers I know are making that choice so that others can get the vaccine ahead of them. That does not apply based on the CDC guidance that has come out thus far with respect to antibody testing. And I want to just boil it down to the big picture again, which is your antibody test result has no bearing on whether or not you should get a COVID-19 vaccine. So it's not something that's recommended before you get the vaccine. And if you've had an antibody test in the past, regardless of whether it was positive or negative, we're going to recommend that you get the vaccine as well.
Thank you. Such an important point. Related question, several people have asked, after I get the vaccine, do I need to wear a mask still, or am I free of that burden?
Yes, another important question. And the simple answer is yes, you still have to wear a mask even after you get the vaccine. This is for several reasons. The first is that, as we just talked about, it's a 2-dose series. You yourself won't have protection until about 10 to 14 days after the second shot in the series. So that's one really important reason to wear the mask. The other very important reason is that you may still have an asymptomatic infection even after you get the vaccine. And if that's the case, because we're still understanding all of the science around this, wearing a mask is very important to protect others around you so that you're not what's called a silent spreader of the virus. So there are studies underway to understand better whether the vaccines will protect against asymptomatic infection as well. But for right now, the unequivocal answer that I can give you is get the vaccine, keep wearing your mask, keep your distance, keep doing all the things that have worked for us.
That's great. Commissioner, there's a lot of equity implications to how we define essential workers. We've had many questions on this. Of course, first responders, people who work on infrastructure, people who work in transit, they're clearly all going to be part of the essential workers cohort. But what about people who deliver food, who work in supermarkets, who work in laundromats or restaurants, teachers as well, another critical group. Are they going to be included in the essential worker cohort? And And I think you mentioned this before, but about when do we expect to get to that phase?
Yeah, it is a really important issue. You know, I think about all the people, all the occupations that I rely upon, you know, in my day-to-day life, and so many of the ones that you mentioned are truly essential. You know, none of us would be able to live the lives that we're able to without those people who support all the services that we ourselves rely on. So I certainly understand, you know, how important of an issue it is. It's a big category of people, you know, when you think about all of that. So I want to be forthright in saying that there will likely have to be some prioritization, you know, among the group of essential workers. And there are different ways of thinking about this. And the CDC Advisory Committee that is charged with issuing recommendations is taking up some of them. And we hope to have, you know, some more specifics on that in the next week to 2 weeks in terms of prioritization within that group of essential workers. One that I'll just highlight is that, you know, particularly for essential workers who find it more difficult to protect themselves, maybe because they can't physically distance as effectively as other essential workers, you know, that priority based on risk comes into play. So, so we'll get some more information from the CDC. The state is also thinking about this, and ultimately, you know, will give us the prioritization guidance and framework that we as the city will be following, and we'll just commit to, you know, keeping people as informed as possible as those things emerge.
Thank you, Commissioner. I've heard you speak on the imperative of building confidence in this vaccine, particularly in marginalized communities where there's justifiable concern based on generations of racism and neglect in the medical system. I think particularly in the African American community, and frankly, even particularly around vaccination. So it is so critical that we acknowledge this forthrightly, and that we work to build confidence. And I think that in part is going to require on the ground leaders whose voices we can elevate. This is a point that Dr. Blackstock has made very powerfully, that we also have to hear from physicians in the African American community. And it was, I think, really meaningful that the first vaccination yesterday was of an African American health worker by an African American health worker. And but I wonder if you can talk about the plans the city has to make sure that no community is left behind, and that our messaging really seeks to achieve that.
Well, thank you, Council Member, and you've stated it very powerfully, and I appreciate, you know, how much you are calling attention to these issues and doing it in a way that that propels us toward the right approach for you know, for these very for the challenges that we have to confront here. Look, this is what I'll say, and so much of it is born from my own experience taking care of people, you know, taking care of racial and ethnic minorities, you know, people who have lived on the margins for, you know, many different reasons. And what I've found in my own experience in taking care of people is that it starts with listening, and it starts with humility, and, you know, having the wherewithal to not start with one's own message, even if it's a message that I believe in as strongly as I do, that these are safe and effective vaccines, but actually starting with turning an ear and saying, well, tell me about your concerns, you know, and tell me what it is that your values and your beliefs are, so that I can understand that. And we seek to, you know, to have that imbue our approach, not just at the individual level, but at the community level as well. And so that means, you know, working with community partners. For those who saw this morning, the mayor invited some faith leaders, Reverend Phil Craig, Bishop Raymond Rivera, Bishop Hezekiah Walker as well. And it's going to be about, maybe people like me taking a step back and actually having people like that take a step forward because they are, trusted messengers in their communities. And they're people who have been listening to their communities for far longer than others have. And so that's going to be, the characteristics of our approach, and seeking to make it very tangible with respect to expanding access in the ways that we've talked about, and addressing some of the messages in a way that resonates with people.
We only have a few more minutes. This has been just an incredible discussion, but I think it's important to point out that while vaccine provides great personal protection for anyone who gets it, that we're not close to having protection community-wide from vaccination. That's not going to happen this week or next week. Frankly, it'll be months, and I'll ask you, Commissioner, to comment on that. I just want to make the point that we're still going to have to be very cautious about this virus, even though vaccination has begun right here in New York City. The virus is still out there. I started our session tonight by saying we had a report that we're over 4,000 cases diagnosed on the daily number today, according to state data, and approaching 2,000 people hospitalized. So that is the threat today. Could you talk to us, Commissioner, about the timeline and what it will take for us to feel like we have some protection community-wide in the city?
Yes, thank you. And you're absolutely right. It will be many months before we have anything like that community-wide protection that you're talking about. We're going to work as hard as we can to shorten the time frame so that we get to that destination as quickly as possible. But the hard truth is that we continue to see too many cases, too much suffering, too many hospitalizations, as you've pointed out. And so even as we work through getting to that destination, we're going to have to redouble our efforts right now. One of the ways to think about this is, you don't throw the oars out of the boat during the storm just because you see the shore. We really have to take that to heart right now. It's a wonderful, wonderful thing that we can see the shore. But actually right now is the time when we can prevent so much avoidable suffering because we can get people to that destination.
That's a great analogy, which I will now be using. And we're almost out of time. I just want to emphasize again the point you made, Commissioner, that this is a time of real risk for New York City because of the rise of COVID. And yes, wearing a mask is critically important, and washing your hands and these precautions. But we actually need people to do more than that and really stay closer to home if you can, particularly if you're at risk. This is a time to avoid unnecessary, non-essential travel outside your home. We understand people need groceries and you have doctor's appointments, but start to be more prudent about that. All of us really have to try and limit our social contact and probably limit our mobility more than we have. That's something tough to hear, I know, as we enter the holidays. It's probably the worst time to hear that. But there's just no avoiding our current circumstance. So I'm going to pass it back to you for final words. Dr. Dave Chokshi, Commissioner of the Department of Health and Mental Hygiene. We are so grateful for you spending an hour with us. This has just been an unbelievable set of questions from the public, and your answers have been really informative. We could have gone on for many more hours, but I want to thank you and pass it back to you for some final words.
Thank you so much. And it's a privilege to join you as always. My final message is just to echo what you just said and put it this way. Look, we have to make sure that our positive behaviors and our messages are more contagious than this terrible virus. And that is on all of us. I hope each and every one of you who tuned in tonight will well, think about a family member, a loved one, a neighbor, someone whom you can call and say, hey, look, we need to really make sure that we're taking the steps that we need to, because the end is in sight, and it's in our control.
Thank you so much, Commissioner. Thank you, everyone, for participating. Hundreds of you. We do these regularly. We'll do them continually throughout this crisis and beyond. Stay tuned for updates on our next one. And thank you, all of us, for joining us. I wish you all the best and stay safe.